right, so let's talk about some cultural implications when it comes to mental health nursing. So when we think of culture, this is groups that have a shared belief, values, and practices, and it influences their thinking and behavior. When we think about cultural norms, this defines what is normal or abnormal within a culture. This helps members to make a sense of the world around them, helps them to make decisions about appropriate ways to relate and to behave. Then we have your ethnic groups. This is individuals with a common heritage and history. They have a shared worldview of thinking of how the world works and how people should act. When you think about Western tradition, we think about values, autonomy, independence, self-reliance. When we think about diseases that are the causes that, or the things that cause a disease are specific, measurable, and observable. In time, we think about time moves forward and waits for no one. In the Eastern tradition, they say that family has interdependence and is involved in group decision making. There's no separation of body and mind, and belief is around reincarnation, and fate is unchangeable. In the indigenous culture, there's usually lack of harmony between individual and the environment. On the next few slides, I'm going to post some examples. So here's one about among different Chinese patients that you may have, people of India, Pakistan. So please go through and read through some of these. Here's an example of Russian, Hispanic population. I want you to look at the boxes and tables starting on page 86 in your textbook. When we think about enculturation, this is how members receive a culture's worldviews, beliefs, values, and practices. Ethnocentrism is thinking that their way of thinking and behaving is the only correct and natural way. And then cultural imposition is imposing one's cultural norms on another cultural group. Here's some barriers. Remember, therapeutic communication is going to be key. We use therapeutic communication and help to use this to help train and interpreters, and this is also how they're approved and how they are able to communicate with the patients. Don't forget also to include nonverbal communication. Stigmas create a barrier to seek help because usually, such as a fear or a bias, they may feel shame. Inappropriate tools for diagnosing can lead to a misdiagnosis, so we have to be very careful. On your regular PowerPoint, it probably comes up easier unless you want to cut and paste. There's a video here for you to review. Culture-bound syndromes. This is a set of signs and symptoms that are common in a limited number of cultures, but may be non-existent in other cultural groups. And then you have your genetic variations in drug metabolism, and so you need to make sure that we are giving the correct drug and dosage for that patient within that cultural group. One thing I want you to pay attention when we talk about some of these groups at risk for inadequate care is your immigrants, your refugees, and cultural minorities. And two words I want you to look up: acculturation and assimilation. Cultural competence, there are 5 topics under cultural competence, especially for psych nurses. Cultural awareness, this is examining beliefs, values, and practices of your own culture And recognize that during a cultural encounter, 3 cultures are intersecting: the culture of the patient, the nurse, and the setting. When it comes to knowledge, we want to learn by attending cultural events and programs, forge friendships with diverse cultural groups, learn by studying. Learning cultural differences helps a nurse to establish rapport, asking culturally relevant questions, and identify cultural variables. And all those need to be considered so you have that background knowledge. Encounter. It's very important that nurses deter from stereotyping. This helps nurses to gain confidence in cross-cultural interactions, and it helps nurses to avoid or reduce any type of cultural pain. When it comes to cultural skill, this is the ability to perform a cultural assessment in a sensitive way, use professional medical interpreter to ensure meaningful communication. You want to use culturally sensitive assessment tools, and your goal is to have a mutually agreeable therapeutic plan. It should be culturally acceptable and capable of producing good positive outcomes. The last one is desire, and this is a genuine concern for the patient's welfare and well-being. It's that willingness to listen until the patient's viewpoint is understood, and this requires patience, consideration, and empathy. I have a case study posted here, and if you look at your regular PowerPoint, you can actually see the answers at the bottom in the speaker notes. And here's some practice questions for you to look at. And again, the answers are in the speaker notes in your regular PowerPoint for notes. And here's the last one. All right, I will see y'all in class.